Jonathan Hutt. I'm a consultant orthopaedic surgeon at HCA UK. I've got a specialist interest in hip surgery, including hip preservation and hip replacement. Joint preservation surgery mainly reflects surgery for, in my case, the hip joint, where we don't replace the joint, but we are keeping your native hip joint. We are just operating on it to try and improve its function. In general, it affects younger patients, so it generally affects younger active patients. It probably comes into two main categories. So it affects a lot of people who do a lot of sport and therefore, maybe put a lot of strain through their hip. And it also affects people who perhaps have grown up with some form of childhood hip issue as well, which may not necessarily affect them at the time, but as they move into adolescence and then into early adulthood, then their symptoms might become more apparent. I guess, surgery, when is it recommended, I guess is the same as for any surgery. The balance of the potential risks of surgery against the potential benefits of surgery, taken in context with that patient's particular symptoms and how it affects their function and quality of life. That's always the discussion. So it isn't the case that you find something and it has to have an operation. That's rarely the case in orthopedics. But if that problem is causing significant functional problems or symptomatic issues for the patient, then that's when it might be worth having that sort of discussion. Joint preservation, and specifically in my area, hip preservation, is where we do surgery on the hip joint, but we don't replace the joint, which is, I think, is the operation that most people always associate with hip surgery, is hip replacement, because it's so common. There are quite a wide array of different options. It really depends on the underlying issue. Sometimes it's mostly a structural issue with the hip, and so it's either that, for example, there might be more bone or bone in inappropriate places, and that's causing injury or damage to the hip. And in that situation, you can do keyhole surgery or arthroscopy sometimes to evaluate the joint and then remove that bone and hopefully solve the problem. In other situations, sometimes the sort of overall structure of the bone itself is either malaligned or different or altered in a way that's causing the symptoms. And that may require us to actually restructure the hip itself by cutting the bones and repositioning them. If it's done correctly, I think, joint preservation surgery is associated with extremely good outcomes. And really, then again, we're talking about orthopedic outcomes, which are generally relief of pain and symptoms, return and restoration of function. I think the most important point about joint preservation surgery is perhaps less widely done. And the really key point is to make sure the correct diagnosis is made so that the appropriate operation is done at the correct time. Okay, well, I suppose as with all surgery, there are always risks as well as potential benefits. I think the good news in orthopedics is that, certainly major or significant risk after surgery or during surgery rather is not all that common. There are general risks and then there are very specific risks to the types of procedures you do. So I think as that answer to that really is that each procedure has a slightly different profile of risk and potential problems. I think the key point really is to make sure that during consultations and follow-up visits with patients, we discuss them in as much detail as people want, so they really understand what to look out for after surgery and really how to raise any concerns. We're a pretty big team here at the hip unit, so there's always a point of contact 24/7 if there's a problem, and they can always get hold of us if we need to have a discussion with the patient about any concerns they might have. Okay, that's actually a pretty key point for most joint preservation surgery, because actually the rehabilitation, particularly the physio-led rehabilitation, in a lot of cases is as important as what I do to the hip joint as well. So it again varies slightly depending on the procedure, depending on the symptoms, depending on where we are in that patient's journey. So it's hard to be overly specific about that answer. But again, I think what's key is that we try and get people to engage with a bit of prehabilitation in the period before surgery, if that's possible, so they can build a relationship and a rapport with a physio and go back to them post-operatively with a good understanding of where it is they're trying to get to. We obviously see ourselves as a good point of contact, not only for the patients, but also for the physios leading that rehabilitation, so that we can stay in touch throughout the process. We're joint preservation surgeons, but we're also hip replacement surgeons. So that allows us not only to kind of make the right decisions for patients about what is the appropriate operation, but treat the whole variety of hip pathology pretty much from adolescence to old age. And I think that makes us as a group of surgeons quite unusual in the field of hip surgery.